Able to get support to Tiger Woods in that very devastating accident. Thank you for making time for us today. I imagine you've got a few more interviews coming your way.
Yes.
You're getting pretty good at this. I'll tell you that, from one professional to another.
Well, thank you.
And joining us now to talk about the extent of Tiger Woods' injuries from Orlando, Florida, is Dr. Gideon J. Lewis. He is a reconstructive foot and ankle surgeon. Doctor, from what you've heard, how likely is it for Tiger Woods to return back to the game of golf?
First of all, Regina, thanks for having me. Tiger Woods experienced and sustained a horrific injury. With Tiger Woods, you never want to bet against him, but with these type of injuries, there's a lot of unknowns. Without looking at the specific case of him, but getting all the medical reports that are up to date, the chances of him returning is very unknown, but his injuries, there's an algorithm of how you treat these conditions, and so far it appears like all the proper protocols are being followed, which eventually leads to a really good success. Now, returning to a high level of playing professional golf is a different story. We know many athletes have returned from horrific injuries such as this, such as Alex Smith, most recently, returning back to the NFL. And then you have athletes like Paul George going back to the NBA. So we know that's possible.
Now, Dr. Gideon, we're getting reports specifically about what the injuries are. Can you explain to us, for those who maybe have no idea, what exactly is an open fracture?
Yeah, good question. So there's anytime like you kind of look at some of these long bones, in which those are the main injuries that he sustained, and with Tiger Woods' case, they're almost like a long. I use a silly analogy. It's like a PVC pipe where it's a thick cortex on the outside and there's a hollow middle, and when the bone breaks, if there's enough force, it will actually puncture through the skin, causing that force. And an open fracture means it's exposed. There's a communication from the environment directly into the body, which the high risk for that type of injury is infection. It appears that Tiger Woods did, as I mentioned, receive treatment in a very timely fashion, which decreased that chance for infection, which is right at this point, this is the number one concern. So with that open wound, that is the open fracture.
I think also something that we all noticed is that they sprung him into surgery so quickly. What could have happened if doctors didn't act as fast?
No, good question. That's the craziness of this trauma surgeries. You had to be able to act quickly and make a immediate assessment. In his case, there was some type of level of increased compartment pressure. Most of the muscles in your legs or even your arms, they're encased by a compartment. And when the compartment gets really a lot of increased pressure, almost like a tire, where it just gets a lot of pressure, you had to release that pressure. Otherwise, you're going to have a possible muscle damage, as well as it's going to compromise the blood flow, which could eventually lead to an amputation or permanent muscle damage.
And as we continue to kind of talk about the extent of his injuries and his career and his legacy, it's been brought up a few times that this isn't his first car accident or the first time that he's had extensive surgery. Is this playing a part in from your medical expertise? Would this play a part in the recovery process or how they're handling the surgery process?
From the surgery standpoint, I'm not too sure what really changes, but for Tiger Woods, for anyone who's gone through this, one of the most difficult part is the mental component, knowing the long recovery. He's been through that with his back, so he knows mentally what it's going to take for a possible return to professional golf. So he has that on his side, which is a huge advantage. But as we mentioned before, the biggest unknowns are the infection, the wounds that he has, and also there's the most latest report that the talus, which is a bone that makes up part of your ankle joint, which is a key component for basically laying down the foundation of when you stand and walk, and for a golf swing, that's vital. There's a part of that bone, it's unknown if the cartilage, which that's a portion of the bone that makes up your ankle joint for when you pivots. If that was violated, that can lead to stiffness or like arthritis type pain, which can lead to more chronic issues. So there's still a lot of unknowns, out there. But the fact that he's been through this before with other injuries, the mental component is a huge advantage that he has.
Right. Now, Dr. Gideon, is there anything that kind of stands out to you, something that you really notice with this case?
The things that really stand out, I mean, most of the type of injuries, even though it's like very horrific, most trauma surgeons, even people in my industry and my specialty, a lot of this is very is straightforward as far as how to manage these issues. Obviously, it's not that often with professional athletes, especially in this case of Tiger Woods. But with the thing that really stands out is the foot injuries, the leg bones. The way those are treated, those are pretty straightforward, and they heal pretty well. And there's enough documentation to support that. The foot is a little different. There's so many bones in there, and they all articulate and they work in so many different movements. So it's hard to know if there's any cartilage, as I mentioned before, or which could lead to some joint issues. That's the part that you're more concerned with, is with that talus, which is that bone that makes up the ankle joint. That's the part that stands out the most to me.
And as you mentioned, there are, again, so many unknowns. Dr. Gideon J. Lewis, thank you so much for joining us this morning on News Now from Fox.
Thank you.
All right, guys, some of you will now see a 2-minute commercial break. We will be right back.